So the next psychotropic medication we're going to talk about is lithium, and lithium is a part of the category called mood stabilizers. And so this will go through 577 and 578. So lithium is the most common medication used to treat bipolar disorder. And lithium is just a naturally occurring substance that counteracts manic symptoms and to a lesser degree some of those depressive symptoms that bipolar patients have. Its effectiveness in treating bipolar disorder has been well established since the 1960s. Lithium can prevent the acute manic episodes over the course of a week or two. Once that acute manic episode is under control, the long-term use of lithium can actually prevent relapses into either mania or major depressive disorder. The majority of patients respond well to lithium therapy. It, however, does not work for everyone. Some people who use the lithium therapy can have relapses, or one patient that I worked with who was using lithium, she had no moods at all. She didn't feel anything. She never felt happy. She never felt sad. She never felt anything. So in people like that, they explore other medication options, and we'll kind of talk about those as we go through. So, as with any medication, lithium has potential side effects. If the lithium level is too low, it can cause manic symptoms. They persist, they don't go away, there's no change in the mania. If the lithium levels are too high, there's a potential for lithium poisoning. So lithium poisoning has symptoms like vomiting, muscle weakness, or reduced muscle coordination. So because of these things, they actually monitor a patient's lithium blood levels very carefully. So lithium works by affecting levels of the excitatory neurotransmitter called glutamate, and is found in many different areas of the brain. Lithium stabilizes the availability of glutamate within a narrow normal range, preventing both abnormal highs and abnormal lows. So it says, okay, to prevent extreme highs, we need to be here. To prevent extreme lows, we need to be here. And that's where lithium keeps the person. So bipolar disorder can also be treated with an anticonvulsant medication called Depakote. So it was originally used to treat epileptic seizures, and it seemed to be really helpful in treating people who rapidly cycle through bouts of bipolar disorder several times a year. Some other mood stabilizers you may have heard of: Lamictal, Carbatrol, and then Depakine. These are all different mood stabilizers that are also out there and available. Well, your book only talks about lithium. There are these other mood stabilizers. Just like we've talked about with all the other medications, there are other ways to treat bipolar other than the mood stabilizers. And believe it or not, it's in the antipsychotic family. So things like Zyprexa, Seroquel, Risperidone or Risperidol, Abilify, Clozapine. These are all different medications in that antipsychotic family who can be given to people who are suffering from bipolar and can help them with mood regulation and help prevent the mania, but also keep those depression symptoms under control as well. So again, like with all the other therapies, regardless of what's used, lithium, whatever it may be, additional treatment through therapy, through psychotherapy, whether it be individual or family therapy, can increase the likelihood that a patient will take his or her medication as prescribed and be able to reduce those symptoms. Some people actually enjoy the manic episodes. And so for some people, it's very difficult to get them to consistently take their medication because they want to feel all those highs of mania. They want to feel all those things. And so by doing things like having them continue through therapy, we can help them to understand why it's important for them to be on their medications, and remind them of the negative sides of the mania, because it's not just all wonderful things. They might be overspending, they might be, having affairs, going out and doing all kinds of crazy things. So the talk therapy piece is important even when a person is on some sort of a psychotropic for bipolar.